I am Dr. Mahendra Verma, Senior Lecturer in Zoology, Sri Chaitanya Institutions. In this session, I would like to explain the human endoskeleton. Any support giving structure is called skeleton, which is of two types: endoskeleton, exoskeleton. Endoskeleton means present within the body, whereas exoskeleton is present on the outer surface of the body. Exoskeleton is present in the arthropods, echinodermates, which is a rigid structure. Endoskeletal components are present within the body. Mostly they are made of bones and a few cartilages. In human endoskeleton, we can divide these skeletal components into two parts, basically axial skeleton and appendicular skeleton. Axial skeleton means the skeletal components present on the central axis of the body, whereas appendicular skeleton means the skeletal elements which are attached to the axial skeleton. Now see this diagram. This diagram represents entire endoskeleton of the human beings. The white components represent axial skeleton. That includes skull, sternum, vertebral column and rib cage or ribs. Whereas these green colored components, they represent appendicular skeleton. These skeletal components are attached to the axial skeleton. The appendicular skeleton contains pectoral girdle, pelvic girdle, upper limbs and lower limbs, limb skeleton. The axial skeleton in total contains 80 bones. Appendicular skeleton is made of 126 bones. Altogether, 206 bones are present in the human endoskeleton. Total 206 bones. Now see the details. Our skull contains total 29 bones. Sternum is a single piece of bone, whereas vertebral column contains 26 individual units known as vertebrae, and there are 12 pairs or 24 ribs are there in the rib cage. So altogether 80 bones together forming the axial skeleton. Then come to the appendicular skeleton, which comprises of two girdles. One is the chest girdle, pectoral girdle. Second one is the hip girdle, pelvic girdle. The upper limb bones are attached to the pectoral girdle, whereas lower limb skeleton is attached to the pelvic girdle. Each pectoral girdle contains 2 plus 2, 4 bones. Each half of the pelvic girdle is made of a single bone, so 2 bones together forming the pelvic girdle. And each limb contains 30 bones, that is 30 plus 30, 60 bones are together forming the upper limb skeleton, whereas each lower limb also contains same number 30. 30 plus 30, that is the 60 bones. So if you sum up all this, the appendicular skeleton contains total 126 bones. Skull. Skull contains the following parts: cranium, the brain case, facial bones that form the anterior part of the skull, and ear ossicles. There are 3 number in each internal ear, 3 plus 3, 6 ear ossicles, and 1 hyoid. Altogether 29 bones. Now first see the cranium. Cranium is composed of 8 bones. The first one is the frontal bone. Frontal bone, it is an unpaired bone that forms the forehead. Then a pair of parietal bones. Parietal bones, they form the roof of the cranial cavity and they are paired structures, parietal bones. Temporal bones, they are present on the lateral sides of this cranium. There are 2 in number, and one occipital bone which is large that form the base of the cranium. This occipital bone at its base contains a wide aperture. This is called foramen magnum. Through this foramen magnum, the spinal cord extends into the backbone. On either side of the foramen magnum, there are two condyles are there. That's why human skull is described as dicondylic skull. As our skull contains two condyles, hence the name dicondylic skull, a characteristic feature of a mammalian skull. Right, so these are the main visible bones. There is a sphenoid bone is there, one long bone, and ethmoid. This is a small triangle shaped bone, sphenoid and ethmoid. Sphenoid, a single bone, this is commonly known as the keystone bone. At its middle there is a small depression is there, and this depression is called sella turcica, which accommodates the pituitary gland. Ethmoid, this is a small irregular shaped bone present at the anterior part of the cranial cavity. So these are total 8 bones together forming our cranium, the brain case. Next, facial bones. There are total 14 facial bones are there that form the face region of our skull. They include nasals. These are the nasals. They form nasal bridge. There are 2 in number. They form the nasal bridge. Next, maxillae. These are the maxillae. 2 in number. Maxillae, they are 2 in number. They form the upper jaw and having alveoli to accommodate the upper jaw teeth. Each maxilla contains 8 alveoli. So total 8 plus 8, 16 teeth are accommodated within these alveoli of upper jaw. Next, zygomatics. These are the zygomatics, generally known as the cheekbones. They are also 2 in number. Zygomatics, the cheekbones, they form into an arch. This arch is called zygomatic arch. And a pair of lacrimals. These are the lacrimal bones present within the orbit of the skull. Lacrimals, they are 2 in number. And these are the very small bones of our face, lacrimals. Next, inferior nasal conchae. These are the inferior nasal conchae, that are the turbinals. They help in the conditioning of the inhaled air. They are also 2 in number. Next, palatines. A pair of palatine bones are there. These palatines, they form the hard palate of our buccal cavity, a roof of the buccal cavity, palate. Vomer. This is a single triangle shaped bone present beneath this nasal cavity. Vomer, a single triangle shaped bone. And the largest movable skull bone, that is the mandibles. A single mandible is there. Single mandible is there, and this is the longest movable bone of our skull. Is the mandible. Only one bone. This mandible contains 16 alveoli to accommodate 16 teeth. And mandible is the largest movable bone of our face, facial bones. So total 14 facial bones are there in our skull. Then on each side, the internal ear, connecting the external ear and internal ear, there are 3 ear ossicles are there. They include malleus, incus, and stapes on either side. So 3 plus 3, total 6 bones are there. These are the ear ossicles. They help in the transmission of sound waves from tympanum to the internal ear. Among these 3, stapes is the smallest bone in our endoskeleton. The smallest bone of our endoskeleton is the stapes. There is a single hyoid bone is there, which is not attached to any other bones of the skull. Hyoid bone, this is an U-shaped bone like this, and it gives support to the larynx. This is the larynx. It gives support to the larynx, and moreover, some of the tongue muscles are attached to the hyoid. Some of the tongue muscles are attached to the hyoid. That's why this hyoid bone is popularly known as the tongue bone. The tongue bone. As it is not attached to any other bone, it is suspending within the neck just above the larynx. So this is the hyoid bone, a single piece of bone not attached to any other bone of the skull. Next part of the axial skeleton is the vertebral column. There are total 26 vertebrae are there. There are 7 cervical vertebrae, there are 12 thoracic vertebrae, 5 lumbar vertebrae, a single sacral vertebra, and coccygeal vertebra 1. Cervical 7, thoracic 12, lumbar 5, sacral 1, coccygeal 1. Sacral and coccygeal vertebrae, they are fused vertebrae, altogether 26. Among these, the largest vertebrae are the lumbar vertebrae. They are the largest vertebrae. So C7, T12, L5, S1, CO1. This is what you call the vertebral formula. Vertebral formula of man. Next one is the sternum. Sternum is the chest bone or breast bone. It contains a single piece of bone but divisible into 3 parts. The upper portion, which is hexagonal, this is called manubrium. The middle portion is the body, and lower portion is the xiphoid sternum. Xiphoid sternum. So these 3 parts together form a single piece of bone. This is called sternum, to which the ribs are attached. There are 12 pairs of ribs are there. They extend from the vertebral column to this sternum, forming the rib cage. So 12 pairs of ribs are there. Of these 12 pairs, the first 7 pairs are the true ribs. They are extending from the vertebral column to sternum. Hence, these are known as vertebrosternal ribs. Vertebrosternal ribs. There are 7 pairs. The first 7 pairs are the vertebrosternal ribs. 8th, 9th, 10th, 8th, 9th, 10th ribs. These are known as vertebrochondral. Vertebrochondral ribs. As they are extending from the vertebral column and joins the costal cartilage of 7th vertebra. Hence, these are called vertebrochondral ribs. 8th, 9th, 10th. Next, 11th and 12th ribs. These are floating ribs. Or vertebral ribs. Vertebral ribs. Because they are attached to only vertebral column. On their distal ends, they are free. Hence, these are called floating ribs. 9th, 10th, 8th, 9th, 10th ribs are vertebrochondral. These are called false ribs. 11th and 12th ribs are the floating ribs. Our ribs are double headed, having two heads like this. There are two heads are there. These are these are capitulum, tuberculum. So there are two heads are there, and the distal end, this is what you call costal cartilage. In between, this is the body of the rib. This is the body. Right. This is the capitulum. This is tuberculum. This is body, and this is costal cartilage. As there are two heads are there, the ribs are described as bicephalous. Our ribs are bicephalous ribs or bicephalic ribs. These are the total 12 pairs of ribs. Next, girdles. Girdles are a part of appendicular skeleton. We are having two girdles. Pectoral girdle or the chest girdle, pelvic girdle, the hip girdle. Girdle means a semicircular structure, more or less like this. This is what you call girdle. Each half of the girdle contains two bones. There are two bony elements are there. These are scapula and clavicle. Each half contains one scapula, the shoulder blade, clavicle, the collar bone. So the total number of bones in the pectoral girdle, 2 plus 2, that is 4. Similarly, each half of the pelvic girdle is made of a single piece of bone known as coxa. So these two coxae together forming the pelvic girdle. So 4 plus 2 total 6 girdle bones are there in our endoskeleton. Next, limb skeleton, upper limb skeleton. Each upper limb contains 30 bones. So 30 plus 30, 60 bones are there per each limb. Upper limb contains 60, lower limb also contains 60. Altogether 120 bones. The upper limb bones, they include humerus, radius, ulna. There are 8 carpals, 5 metacarpals, and there are 14 phalanges. The phalangeal formula is 2, 3, 3, 3, 3. That is thumb 2, remaining 4 digits with 3 phalanges each. So total 14. There are 14 phalanges. So if you sum up all this, you will get 30 bones. So each upper limb contains 30 bones. 30 plus 30, that is the 60 bones. Next, lower limb. Lower limb contains the following parts: thigh, shin, ankle, instep and toes. Ankle, instep and toes together form the foot or pes. The thigh is internally supported by thigh bone, the femur, whereas shin part is internally supported by tibia and fibula, and ankle is supported by 7 tarsals. These are the heel bones, tarsals. in step, this portion is supported by 5 metatarsals and toes are supported by total 14 phalanges. Here also the phalangeal formula is 2, 3, 3, 3, 3. That is, the great toe contains 2 phalanges, the remaining 3 toes they contain 3 each. Total 14 toes, 14 toe bones, and there is a one more bone, that is patella, the kneecap. Including patella, there are total 30 bones are present in each lower limb. So 30 plus 30, 60 bones together forming the bones of the lower limbs. Okay. So this is the endoskeleton of our body.